So we have Dr. Soliman here today, or Dad, as one of my call him. You can tell already, he's our dad. We basically look like twins, so it's kind of obvious. And we are going to talk about sclerotherapy today, or leg vein treatments. Dad has been doing this. He learned the technique in France in 1992, so he's been doing it for a better part of 30 years. So he's kind of like the guy to ask. So we're going to ask him some questions, and we'll learn some stuff too, hopefully.
All right.
So, Dad, why do some people get varicose veins and some people don't?
Varicose veins it's predominantly genetic in nature. So people are born with fair skin, dark skin, light hair, dark hair, and some people they born with some big, weak veins genetically. And pregnancy tends to increase the chance of having varicose veins, prolonged standing. We do a lot of teachers, a lot of nurses because of the prolonged standing.
Hairdressers.
And hairdressers. All that will lead to having varicose veins.
Mm-hmm. How many sessions generally do people need?
Varicose veins depends on what kind of treatment you will need. If you need surgery, surgical removal, it's only once, but it doesn't end at that stage because you need to inject the tributaries or the branches of the veins. If you need endovenous laser, again, you need more than one session. The bottom line is you can't have one treatment and stop because the veins are weak, so your body will always produce weaker dilated veins.
So the way that you treat veins is to inject them. So you inject them with a particular medication? How does that work?
I inject or I do sclerotherapy. Sclerotherapy is when you inject inside the vein small amount of special solution called sodium tetradecyl sulfate to irritate the inner lining of the vein, and they stick together and it works like a glue inside the vein. That's how it works. We do it in sessions because you can't do it all in one treatment. So as you said, Monica, it's a sessional treatment every 2 weeks.
So sometimes when people are being treated for sclerotherapy, they report feeling a little bit of pain or discomfort in one particular area, and they come back. So what happens at that point?
Yeah, if I'm injecting a medium size or a large size vein, so what we're trying to do is we're trying to block a much bigger vein than usual. So we apply pressure after the solution. We use a stronger solution in that spot. We apply pressure from the outside through the compression and the cotton we're using on the outside, and they keep walking to get the best results. A little bit of blood inside the vein can coagulate. It's not a blood clot. There is a big difference between what happened inside the vein because it's trapped. So it's not going to travel anywhere and it's not going to cause deep blood thrombosis.
And when is the best time to treat? Is it a seasonal treatment?
Spider veins can be treated all year around. The medium size to a large size varicose veins best treated in winter because in the summertime they dilate and it voids the purpose of the treatment. So we prefer to treat them in winter because they have to wear as well the compression stockings for throughout the treatment.
Okay, and how long do they wear the stockings for?
Between 1 week to 2 weeks. It depends on the size of the veins. Can I add one more thing, please? If a lot of patients, they ask me, okay, what we're going to do after this? After we finish, we usually get rid of about 70 to 80% of the veins on your legs. We can go to 100%, but it means that you need extra sessions. Once every 6 months, you need to have maybe a maintenance treatment, or maybe once a year or once every 18 months. Everyone is different. That's why we advise patients to come regularly. Otherwise, the vein will her leg or the leg will have new veins in due time.
Okay, great. Well, thanks for the explanations. Hopefully we asked the questions that you guys had. If you have any more, come in and meet Doc. We can meet with us and we can go through it in a little bit more detail.